Hi, this is gum disease video number 1. Healthy gums do matter. I'm Jo Werdnam. I'm a dentist and practice owner at Burgess Dental in West Sussex in the UK. I want to talk to you today about gum disease, what it is and why you might want to take it seriously. Gum disease is very common, so please don't think for a second you're on your own. Watching this video is obviously free, and if it saves you time and money watching me rather than listening to your dentist or hygienist talking to you about the same things at the practice, it might well be worth a watch. So, who is this video for? Who is it aimed at? It's people who have gum disease, who have been perhaps actively directed here by your dentist or hygienist at the practice, or you may have just come across us randomly, but however you've got here, you're very welcome. You might be a new patient at Burgess Dental and your dentist has told you that you have got gum disease, or you might be an existing patient and actually been seeing your hygienist quite regularly, and we have identified the fact that your treatment has just stopped working and your gum condition is actually starting to deteriorate. And for you, this is your reboot video or your reset button video. So I'm going to go back to basics a bit, so apologies for any repetition. I mean, you may well know some of this already, but it's an important message. I'm going to talk to you about what gum disease is and why you should bother taking it seriously. So gum disease is a disease of inflammation. Your body produces inflammation, a bit like arthritis. So in arthritis, the inflammation attacks the joints. And in gum disease, the inflammation attacks the bone that supports the teeth. We know what causes the inflammation, it's bacteria, and the bacteria trigger inflammation, and the inflammation destroys this bone around your teeth. The problem is for you that your trigger point for inflammation, if like you're susceptible to gum disease, it's really sensitive and it's set quite low and much lower than other people. So your current teeth and gum cleaning regime, while it may be very good, it's simply not good enough, unfortunately, to switch off this trigger point for inflammation. You know, it's really not fair because we see people, frankly, who really don't make a huge amount of effort with cleaning their teeth, and there's a lot of plaque around. And while they may get bleeding gums, the first of the stages of gum disease, they don't ever go on to get the bone loss, and because they're just not susceptible. And we know that that is just so not fair. But gum disease isn't fair. It doesn't care. It's a little bit like coronavirus. So just as an aside, I'm recording this in May 2020. We are in the middle of the coronavirus pandemic. Actually, we don't really know where we are. We're hoping we're over the worst, and I'm hoping that you're watching this on the other side and that you're all safe and well and everything is okay. I do hope so. But whenever you're watching this, this message is still important and relevant. So gum disease is on the spectrum. So at this end, we've got a perfect health, which just moves slightly into a little bit of inflammation, which is totally reversible. You'd notice a little bit of bleeding gums. At this end of the spectrum, we have got teeth falling out. So perfect health, teeth falling out. You are somewhere in the middle here, and we want to move you further back this way. We can't, unfortunately, get you back to perfect health because you will have lost bone, and we can't put the bone back. What we don't want to happen is for you to end up at the other end of this spectrum and lose teeth. So that's what we're trying to do, is to move you down in this direction. So if you've got gum disease, I'm talking about those of you that when you're in the dentist chair, when the dentist is doing a sort of basic gum examination, you'll hear numbers like 3s and 4s. And when your hygienist is measuring around your teeth with a probe, you'll hear her measuring pockets at sort of 5 or 6 or even 7 millimeters. And you might find that your gums are a little bit tender. They probably bleed when you brush. And people always think that, if my gums bleed, it means I'm brushing too hard. It doesn't mean that at all. It just means that you are identifying areas in your mouth where you've got active gum disease. Your gums might look a little bit red and swollen in places, and they might feel a little bit uncomfortable. Sometimes you might even have a bit of gum recession, so you look a little bit long in the tooth in places. You might even have a couple of teeth that feel slightly loose, a bit more mobile than they were before, and things like eating into apples is now more difficult than it used to be. So, as we said, gum disease isn't fair. You almost certainly have a genetic susceptibility, a predisposition to gum disease. So you can blame your parents if you like. You may be a smoker, and I'm not even going there. You have enough people nagging you already without me jumping on the bandwagon. But just know that smoking accelerates bone loss in gum disease. You might also have type 2 diabetes. This also makes the situation more complex, and it means you're more susceptible again to gum disease. You might be somebody who isn't really eating very well or looking after themselves, and you're just not spending that time or energy in making sure that you're okay. So why do we bother treating gum disease? It's not usually that painful, not until the end. It's a relatively quiet but insidious and progressive disease. So there are 3 reasons I think you need to take gum disease seriously. And the first one is that the end game with gum disease is that your teeth fall out. And I mean that they literally fall out like baby teeth. The bone that supports them is gradually lost until none remains at all. It doesn't usually happen. We usually intervene before you get to that point and we take the teeth out. But please, again, I'm sorry, but you can't assume if the worst comes to the worst and I lose my teeth with gum disease, I can always have implants. Implants are always going to be an expensive investment, and if you lose your teeth with gum disease, you lose the bone that supports the teeth. And before you can have implants put in there, you have to put the bone back again. And this is always more expensive, time consuming, if it's even possible. And the other thing is that the disease process that caused the loss of teeth in gum disease, if you don't address it properly at this point, will cause implants to fail as well. So if you're not extremely careful, you may find that the only option for you if you lose your teeth with gum disease is dentures, is false teeth. The second reason that I think you should take it seriously, and this is a really difficult issue, it's very sensitive, and I'm really sorry if I offend or upset anybody, but I think it's very important that I'm honest. If you have active gum disease, your breath will smell. Sometimes it'll smell just a bit stale. Sometimes it will be much worse than that. And you may unfortunately be totally unaware. The bacteria that are involved in gum disease produce the sort of sulfur type gases. And these smell very bad. Extremely unpleasant. You might get a sour taste in your mouth every now and again, and that's part of the same process. I don't need to go into the social consequences of having bad breath, or even just not being confident that your breath smells fresh. There's so much shame and embarrassment around this subject, and We admit that we as dentists and as hygienists find it really difficult to talk to people face to face about that, and we frequently don't. The third reason that I think it's really important you take your gum disease seriously is because, as we said, gum disease is a disease of inflammation, and the toxic products of this inflammation process end up in your bloodstream, and they travel in your blood and they can cause havoc elsewhere in your body. Most of the research has been done on the relationship between gum disease and heart disease, but there are lots of other areas where it will cause problems. So I'm not saying that gum disease is going to kill you, but I can't say it isn't either. But what I can say with a degree of certainty is that it will, if you have gum disease and you have lots of inflammation in your mouth, it will impact negatively on your general health going forward. So you need to decide if it's important enough for you to manage your gum disease. Because, and this is a really important message, this is the whole point of this video, we can't do it for you. This is so important, and I'm going to repeat it. We cannot get rid of your gum disease for you. So all that expensive, clever, cutting-edge kit that we have in the hygienist room and all our highly skilled clinicians, it's all a bit irrelevant. Dentists and hygienists are generally, we're real big control freaks, perfectionists. We really hate the fact that we can't take charge and get rid of your gum disease for you. But unless you do your bit first, and that bit means really effectively cleaning your teeth and getting rid of the plaque from all areas of your mouth twice a day, every surface of every tooth every day, we just can't help you. We know you're already cleaning your teeth, but, and I did warn you I was going to be honest, as I said before, what you're doing at the moment basically isn't good enough. And you need to change, and you need to invest much more time in cleaning your teeth every day. And we know that change isn't easy, but nothing we do will make any substantial long-term difference unless you do your bit first. So you need to find the time every day when you're not too tired and you're not too busy to clean your teeth and gums really well. The battle with gum disease is won in your bathroom, not in our surgeries. I'm not going to talk about how you clean your teeth. We'll do that later in another video, but I just want the penny to drop with you that you need to change what you're doing forever if you want to manage your gum disease and have a stable, healthy, fresh smelling mouth. And you've heard dentists, including me, bang on about, 2 minutes twice a day, use an electric toothbrush cleaning between your teeth. If you've got established active gum disease, you will have areas in your mouth that are really difficult to clean effectively. And the worse your gum disease is, the more difficult it is to clean. And we're talking about a good 10 minutes, at least once, maybe even twice a day, every day. You don't cure gum disease. You don't just do something for a little while and it's better. You have to manage it. It's a lifelong battle. It's a bit like losing weight. So it's not going on a diet for a while and then going back to normal eating. If you want to lose weight permanently, it's adopting changes in what you eat from now on. And it's the same with gum disease. You need to find that time somewhere, and you need to establish a routine if you're really going to be serious about doing it. You just can't get away with a quick whiz round with your electric toothbrush and forgetting about using your TPs because you're too tired, it's too much hassle and you just can't be bothered. Equally, using your TPs the week before your hygienist appointment and 2 weeks afterwards, it really isn't going to work, and we know it happens. It takes time and commitment to get rid of the plaque effectively and consistently in your mouth, and it can be really frustrating. You need to become fairly obsessive about cleaning your teeth and gums, and you need to become much more aware of your mouth, much more familiar with the shape and spaces that you have in between your teeth. And we might need to show you several times and show you different tools and techniques before you get really good at getting rid of the plaque in some areas of your mouth effectively. But please don't give up. We need you to be persistent. It's this persistence that will lead to success. Inflamed gums can be painful when you try to clean around them properly, first of all, and they will bleed. They're not necessarily painful on their own, but once you start to really get in there and clean them, they will be sore. So cleaning effectively to start with can hurt a bit, and it's messy. There will be blood when you spit, but if you carry on, it will get better, and it'll get better quite fast. You'll notice improvements quite quickly. And it may take you a bit of a time to work out a routine that works for you and fits in with your life. But the good news is that as your gum health improves, the spaces or the pockets around your teeth become shallower and narrower and easier to clean. So once you do your stuff, your self-care well, then and only then does the treatment we can do, the fabulous airflow machine, the skilled and talented hygiene team, become really important. Then we can really help you. We can help you maintain and manage and control and improve your mouths. Then we can really work with you to get significant and lasting improvements. But if you don't do your bit first, we might as well spend our time teaching you Japanese. Okay, so I'm going to use the bath analogy just to help cement this message for you. Now, I want you to just imagine you come back from work, it's been a difficult day, and you fancy a nice hot bath to help you unwind. So you go upstairs, you turn the taps on, check the temperature, add your favourite bath stuff, and you decide to pop downstairs to get yourself a glass of wine or a cup of tea, whatever you fancy, and you're just pouring the wine and something comes on the news, something quite important, and you get distracted. And before you know it, there's water dripping through the ceiling, and that drip starts to get worse. And so you race up the stairs and into the bathroom. And what's the first thing that you do? I am really hoping that you are saying, turn the taps off and rolling your eyes at me. You might also say, pull the plug out as well. And then what's the next thing that you do? It's very difficult without a live audience. But I'm hoping you're saying, next thing you do is mop the floor. So in gum disease, your daily cleaning is the equivalent of turning the taps off, or even just turning them down to a very slow trickle. And the clever bits that we do, that's mopping the floor. So I hope you can really see there's absolutely no point us mopping the floor until you have turned the taps off. So the message is that it is your responsibility to get rid of the plaque in your mouth effectively every day. We can show you how to do that, but we can't do it for you. And unless you do this, we cannot help you manage your gum disease. So once you're cleaning well, once you can clean your teeth with no trace of bleeding, we can then really help you improve further and help you maintain your mouth in a stable, active, disease-free state. And once you've got rid of the inflammation in your gums, any treatment we provide after that is going to be much more comfortable. So the solution's in your hands. You have control. You need to see thoroughly cleaning your teeth and gums as a vital part of your daily overall health and fitness routine, as important as eating and sleeping well and exercising. So I hope that's helped. I hope it makes sense. And you may find that your dentist or hygienist, when you see them next, will ask you what you've learned. So We're going to do another couple of videos. The next video will be video number 2. That's not terribly surprising. And this is going to explain how gum disease happens. It's explaining it in detail, so you've got a picture of what's going on in your mouth to help you understand what you're doing with your TPs, etc. So I hope this has helped, and we will see you next time. Thank you for watching.